My name is Dagmar Elamu, and today I'll be discussing about a very important topic as well, and it is healthcare. So to be specific, I'll be discussing about Obamacare, also known as Affordable Care Act. I recently read about a story that was on a New York Times magazine, and it was about an employee at a company who got off getting medical attention because of lack of health insurance. And now he has advanced colon cancer. Very sad, I know. As a person who lives in a low-income community, I often see how important healthcare insurance, specifically Obamacare, how important it's been in my community. According to Family USA, a healthcare advocacy group that supports Obamacare, estimated last year that an American dies every 20 minutes from a lack of insurance. And this leads us to question that the very recent executive order, which President Donald Trump signed in the Oval Office shortly after viewing the inaugural parade on Friday, repealing Obamacare, which was one of the first acts of presidents. Therefore, today, I will first discuss what Obamacare is, and we'll also discuss the benefits of Obamacare and why it should not be repealed. To first discuss what Obamacare is a United States federal statute signed into law by President Barack Obama in March 23, 2010. Obamacare is aimed primarily at decreasing the number of uninsured Americans and reducing the overall cost of health care. Prior to this mandate, individuals with pre-existing condition were often unable to maintain health care coverage. Healthcare surrounding it was very controversial about healthcare reform long before the enactment of ACC, which is also called as Affordable Care Act or Obamacare. While President Clinton's administration failed to overhaul our nation's healthcare system in 1993, with the Health Security Act, the Affordable Care Act was the most sweeping national reform since President Johnson's Social Security Amendment Act. The Affordable Care Act will help Americans lead healthier lifestyle while increasing their financial stabilities. According to the U.S. Department of Health and Human Services, employer-provided insurance is commonplace in America. Nearly 60% of American public utilizes insurance provided by their employer. Which leads me to my first point. So according to the Huffington Post, millions of Americans now have coverage, many for the first time. The share of the nation's uninsured has dropped 12.3% for the first 2 months of the year, from 17.1% in the late 2013 before coverage to the insurance exchange began. And that ensures affordable coverage for more low-income and middle-income families. The Affordable Care Act extends health subsidies to those with incomes from 300% up to 4,000% of the federal level, approximately about $46,000 for an individual. Children can now stay on their parents' insurance until age 26, and as a result, about 5.7 million young adults have gained coverage over the past 5 years. And according to Huffington Post, business owners with fewer than 25 workers may qualify for a tax credit to help pay for employees' healthcare benefits. The law banned insurance from turning away applicants because of pre-existing conditions. So those who were previously denied and uninsured, either because of minor or life-threatening illness, can now enroll to coverage to help them pay for visits, tests, and prescription. Which leads me to say that everyone, in a way, qualifies for annual checkups, and children can also receive immunizations, and women has more access to birth controls and contraceptions. That leads me to my third point, saying that it will help ensure wellness and health. So under Obamacare, doctors and hospitals are increasingly incentivized to treat patients more realistically and to keep them well. To conclude, we should all acknowledge that benefit of Obamacare are the big impact it had made over years. And so we should work together to protect the Affordable Care Act by staying informed and expressing support of the law publicly. Thank you.